Thanks again for staying with us on the program TMI Monday. With me in the studio now is the Incident Manager, COVID-19 Edo State, Dr. Andrew Obi. Dr. Andrew, many thanks for joining us on the program.
It's a pleasure being here today.
Okay. Well, as is already widely known, the second wave of the COVID-19 is on, and what is very obvious is the fact that the numbers are rising by the day. So what are the structures put in place to mitigate this, using Edo State as a case study?
Thank you for this opportunity to be here today. It's important to note that the second wave is real. Edo State started reporting increasing number of confirmed cases 1st of December. And from that time till now, we have reported about 190 confirmed cases. Okay, and these numbers are rising exponentially. And in relation to the structures that the system has put in place, we have a very strong coordination team that is headed by His Excellency, the Executive Governor of the state. Then my role is as incident manager is to ensure that it's well coordinated in relation to the various pillars of the response. In terms of structure, nothing has changed from the first wave, because since March 23rd, when we reported our first index case, we put a very robust structure in place to coordinate the entire response. And what we are doing now is to ensure that the little gray areas in terms of challenges, because challenges are real, we are able to address those issues and to make sure that this second wave, we address it head on. In terms of our capacity to manage cases, we have built that over the past 9 months. Interestingly, over the past 9 months, we recorded over 93% recovery rates from all our confirmed cases that we manage. So in terms of case management, if you have COVID in Edo State, if 10 person has COVID-19 in Edo State, over 9 of them are more likely to recover without any complications or sequelae. So that's the statistics from Edo State. In terms of our surveillance structure, our surveillance structure is well structured into the existing system. We have the EOC, which is the command center, and we are networking into the 18 LGAs, where we also have rapid response team. That is very critical, because surveillance activity will help us to be able to identify persons who meet case definition for testing, and we're able to carry out continually. Even before the second wave, the activities were ongoing, though it dovetailed into November, when we had contained the outbreak in the States. But when we started reporting increasing number of confirmed cases, we have to reactivate the already existing structure. And so the rapid response team across the 18 LGAs is excellent. They're doing a good job. We have a wonderful laboratory base. You know that Edo State hosts 4 molecular reference laboratories. And managing an infectious disease outbreak, your laboratory capacity is something that is most important. And we have built our laboratory capacity thanks to the support of His Excellency. And so we can test as many persons who require testing within the state, and we even help other neighboring states to carry out testing. And so we also have a very strong risk communication team, because at a point, a lot of people thought COVID was over. And so this perception had actually fueled the issue, what we call non-compliance to some of the measures. You can see I'm putting on my face mask. And that has been my identity since the outbreak started in March. Anytime I come out, even if we're observing social distance, physical distancing, it's important for people to see that we must do certain things, because everybody must take responsibility. It's not just about government. Besides, who is government? We are all government. So everybody must take responsibility. And so if you don't have any reason to go out, stay indoors. And if you have need to go out, you must wear your face mask. You must observe hand washing practice. You must have institutions must strengthen their capacity to enforce some of this government directive. Some institution has taken up the challenge of no face masks, no entry policy. Is something that we need to strengthen at this particular time. And the enforcement is critical. It's an area that we have identified that needs to be strengthened this second wave, and His Excellency is trying to work out to make sure that this is done in such a manner that people can buy in, you know, because sometimes our people, we need to be pushed a little bit in order to be able to do that. So virtually all the structure that we put in place in the first wave, they're existing.
Okay.
And we're ensuring that those structures are maintained, those structures are strengthened. Issues that bordered on motivation was even addressed. You know, there was a time motivation is very, very critical.
It's very key, yeah.
And, you know, and it was all over the media. But His Excellency, in his generosity, all outstanding payments of workers, incentives, you know, in the first wave, you know, things that would have maybe affected their morale.
Yeah.
We get those, all persons were owed money, were paid before 31st December.
Okay. Now,
so these are critical aspects.
Yeah, people have been asking this question: what is really key for these numbers that we are seeing in this second wave? In other climes, maybe Europe and America, some have adduced the winter period as being responsible. But back here, we know that it's pretty hot. So what is responsible for these numbers that's going up?
Well, looking at it epidemiologically, one of the greatest drivers of the second wave is non-compliance, or poor compliance to preventive measures. People have thrown precaution to the wind. We had the Yuletide period. You saw what happened in our streets, various event center. People just believe as they do their things as if there's no COVID. That is a major driving force for this second wave. Another very important aspect that we need to look at is the issue of the, our people are very mobile, you know, and Edo State is unique because we have a lot of our brothers and sisters in the diaspora. Quite a number of these persons came in for the holiday. And you know what is happening in UK.
But there's supposed to be a quarantine structure in place.
Yeah, that's the quarantine. So that's why I talk about enforcement.
Yes.
When people don't comply with safety rules, that's why I started by saying non-comply. The greatest driving force for the second wave is poor compliance or even non-compliance. And if we're able to get that issue right, then we'll be able to contain it in addition to other existing structures that we have. So that's one aspect that we also need to look at. And it also forms a critical area that the entire system, not just the state government, but looking at the federal government, we need to look at it critically, you know, to be able to address that aspect. People come in, there must be a system in place to modulate these persons. Most times they come in and they just go into the communities.
Do you think that in a sense contributed to this non-challenge that we're seeing? By way of policies, by way of program, by way of activity. I give you two examples.
Okay.
During the elections, we saw campaigns and all of that happening.
That was like people 3 months ago.
People not wearing masks. Yeah, even if it's like 3 months ago, we could be seeing the results now.
No,
that's one. Then two, there's a recent policy of government asking people to link their BVN or NIN number with their accounts. You go to some of those centers, you find clusters of people. I thought that we are against people clustering or gathering together.
Yes, that is, but you see, sometimes people just want to do things the hard way. You could do that on your phone. You don't necessarily need to go to...
So, but what if you don't have the number ready, registered? If you don't have the number registered, you have to go and register. That's the point.
Yes, so these are some of the issues that we need to tackle head on. And we need to look at it critically. So the system must come up with ways and measures in which what we speak is what we practice. What we say is what we practice. And so that's very, very critical, especially all leading by example. But back to the earlier comment you made, when people gather in numbers, whether it's for election, it's for religious activities, it's for social engagement, that such gathering provides a huge opportunity for the spread and transmission of the virus. And so it's something that everybody, the system needs to look into and take necessary action. So it's something that we need to rework. We need to lead by example so that people will know that this thing is real. And if you notice, in the past 48 hours, we're beginning to have an increasing put up of billboards and some other things. Just
to sensitize the public.
Yes, we need to sensitize our people. Because, like I said, this is a critical aspect of this next phase of the response. People must take responsibility. And if they don't, we'll keep on fueling transmission. So we need to look at the risk communication, taking responsibility. Government needs to do more in terms of regulation, in terms of people coming in, issues that border on the integrity of some of these tests and the manner in which some of these tests are conducted. Edo State has 4 molecular reference laboratories, and we carry out regular quality assurance measures on these 4
facilities.
laboratories.
Okay.
And so any test coming out from Edo State can clearly and categorically say they are very, very correct, and you shouldn't, even if you do it somewhere else, it's going to give you the same result.
Now, I wanted to ask you a question in relation to that, because I heard you say a while ago that when it was successfully managed sometime around November, all of these structures, they were just there.
Yes.
Recently, they were activated. So these numbers that are coming out now, are they product of new tests or old tests?
Yes.
Yes. And then again, what are we testing for? Really?
Yes. Well, testing drives your positivity yield. So once your testing declines, the number of confirmed cases will also decline. But mind you, for every outbreak, it has a natural course that it follows. And so what we are doing when we carry out specific strategic interventions, like managing an outbreak response, is to ensure that we quickly, as much as possible, get as many people who require testing to be tested so that we can quickly contain it. So the earlier we reach out to these persons, get them tested, identify those people who are positive, we can now begin to institute certain treatment measures. As long as these persons are in the community, not tested, they would fuel the spread of this transmission. So in July, we peaked. In August, the numbers started coming down, despite the fact that we were still increasing our testing. Okay. And so we found out that between September and November, in fact, clearly in November, the increased number of testing we were carrying out was not giving us commensurate yield in positive cases. In fact, our case positivity moved from over 50% down to 0.9%. At that point, we knew epidemiologically that we have contained the outbreak. Okay? Now, in December, we made our own projections. This is going to be, you're going to have a large number of people coming because of the festive period. Then we started strategically scaling up our testing. Testing that is surveillance-based. You don't just carry out tests on anybody and everybody. There are certain criteria that you look out for. People who meet case definition. We have what we call active case search within the communities and in the healthcare facility. These are strategic response activities that would help us to identify people who should be tested. Because if you don't test the right people, you won't get the right result. So we're able to do that. We started scaling it up on the first week of December, and we noticed that the numbers kept on rising. And that had been the case. In fact, if you look at the curve for Edo State, you see that second wave is quite real. In the first week of into December, we had 20 cases. It moved to 21. It moved to 32. It moved to 62 2 weeks ago. And this last week that just ended, the New Year week, the Christmas week was 62 cases we identified in the state. And for the New Year week, we identified 72. So you can see a stepwise increase in the number of reported cases. That speaks of an explosion. That speaks on the fact that this is real. The numbers are rising. And when you see these numbers rising, what do you need to do as an individual? You need to take responsibility.
This correlates with what's happening abroad.
Yes. Typically, it's...
but is it supposed to be that way?
Well, now, you talked about the issue about is it possible that the temperature patterns, what is unique about our environment, while we have...
Play a factor.
Yes. Well, to a large extent, you find out that the weather, where climatic condition has its own effects in terms of the transmissibility or spread of the virus. When you have an increasing rising environmental temperature, that slows down the activity of the virus. Okay? And when the temperature gets to a very high level, it can denature the virus, meaning that it becomes ineffective. But then you also look at the climatic condition like humidity. So in the Europe and the Americas just now, you are in the winter period. Sometimes they have -0, temperature pattern. And when you have low temperature, the virus is happy. The activities, they rise up. But apart from that, okay, you could now say, okay, since the environment is quite humid, it's hot, So why should we be having a rising number of cases? The issue here now is this, is that human activity is also another factor that we need to look at. Okay. In terms, and the fact that in our environment, we cluster a lot. Okay. And that creates a very, very good environment for the virus to thrive and to spread. Okay, so that's the problem.
There's been talk about a new variant of the virus. What's the state of affairs with that variant as it relates to Edo State? And maybe give us an insight nationally.
Nationally, yes. the only information we have as to the existence of that variant is the research work carried out at the Redeemers University. Okay. And when you see things like this, it also speaks on our ability. For every outbreak response, there are opportunities, enshrined in the challenges that you have. Okay. Now, in some of this developed world, they're able to identify this because they carry out what we call genomic sequencing. Okay? Now, how much of this do we do in Nigeria? We can only rely on possibility and probability that it's possible that this wave is being driven by the new variant, but we don't have enough data to speak to that. Okay. And so in order to address that, I think what we need to do is that maybe the NCDC, the Federal Ministry of Health, and even state government can also look in the direction of possible sequencing. Because when you carry out sequencing, you can be able to identify clearly that this particular outbreak is as a result of this particular strain or strains.
So we're not certain what is driving this new wave?
So we're not certain whether it's being driven by the new variant or not. And so we need to do more in that particular area, not just within Edo State, but also nationally. Okay. Well, having said that, looking at the pattern, because looking at the numbers and also looking at certain presentations of these clients in the hospital, and as at the time we take samples for them, we found out that based on available data, that it seems that most of the people reporting with this new wave are more symptomatic. They're having more symptoms, okay? When you say symptoms, is that somebody could have cough.
The signs and all.
It could have a fever. Okay. Could have difficulty in breathing. Could have a loss of sense of smell or taste. These are symptoms. But we are finding out just now that most of the confirmed cases seem to be having more symptomatic presentation. Although we are watching the numbers are still less than 200. Yeah. You need to look at in Edo State, we have carried out almost 25,000 tests.
How many tests daily now?
Our average daily testing capacity is 613 tests per day across the 4 molecular reference laboratory. Okay? So what we're saying is that the carrying out and the number of positive cases between 1st of December and now is just less than 200. So, but looking at that number, we see that these persons are more symptomatic than, and that may suggest some form of similarity. What we are hearing is occurring in UK or European countries and now in South Africa, that this strain seems to be more infectious in terms of spread. It spreads faster, but there are not sufficient data to talk about whether it's more in terms
of more deadly. Okay.
Deadly, yes. Yeah. So as we look at the data that are available to us, then we'll be able to speak to that. And also as we strengthen our laboratory capacity within Nigeria, to be able to carry out, these are basic things that we must be able to do.
Let me ask you this question, Dr. Andrew. Do you think that our incapacity to independently carry out some investigation and analysis to determine some critical aspect of this COVID conversation is a big minus to us having a foothold in managing effectively this disease?
Well, I wouldn't want to agree on that because with our laboratory capacity, I can speak categorically for Edo State. Okay. Even as we speak now, cumulatively, in terms of our test per million population, Edo State is ahead of the national data. That speaks to our testing capacity and the quality of our testing within the state. But I understand where you are going to. And the tests the yield from tests, okay? Another important aspect that you need to look at is your case management structure. We have a very robust case management structure. As you speak, we have 3 treatment facilities: UBTH, Stella Obasanjo Isolation Facility, and Ira Specialist Station Hotel. Within these 3 centers, any patient that is identified early, presents early for treatment, and is placed on treatment, has over a 90% chance of survival. So in terms of our capacity to manage cases, it's top-notch, it's excellent.
Okay.
Okay? So, but we know that this aspect of sequencing, the only area now that we need to strengthen our capacity is the sequencing. That's a limitation. That's an aspect that we need to strengthen, but I don't see it as a limitation, I see it as a challenge.
Okay, let's quickly talk about vaccines. I am aware that for the 2021 budget, there are provisions to acquire vaccines. And that has also raised some sort of engagements about these vaccines, these vaccines, some of them, these vaccines, we need to be sure of what we are taking and all of that. There's been a whole lot of uproar about these vaccines. Yeah. What do you make about this? Because I've seen doctors online coming together to say these vaccines are a no for them. All right? Yeah, so let me get your perspectives on this.
Okay, thank you very much. Now, looking at the vaccine factor, now, ideally, vaccination, because this is not the first time we're going to be involved in some form of vaccination. Yeah. Whether we have what we call vaccine preventable disease, you have the polios, you have the measles vaccine, and we know that over the years, they are proven to be very cost effective. So, taking the vaccine builds your immunity, okay? And most of these vaccines actually went through prolonged and rigorous process of certification and validation, okay? Fast track to COVID, okay? And so if we have a vaccine that is safe and effective, okay, then I don't think we should worry about taking such vaccine. Okay, so I think that's the game-changing point there, is to make sure that whatever is put out for population use is safe and effective.